Right. Welcome, everyone, to this meeting of Workers' International Network. This afternoon or morning or evening, wherever you happen to be, we are talking about health services. And I'd just like to start by saying that in its earliest days, capitalism was progressive and inventive and made use of science and technology. And amongst the other things that it did make, in the early stages of capitalism, there were advances in medicine. As capitalism progressed, health services such as the NHS in Britain were brought into public hands and became far more successful in giving medical treatment to wider layers of the population. After the SARS virus in 2003, governments all over the world were alerted to the importance of preparing for even bigger and more deadly, more widespread pandemics that could arise based on similar kind of viruses to SARS. The British government under David Cameron did a little bit of work on what it should be doing to update its medical services and in response to this. And the response of the Tory government in those days, this was in the early 2000s, after 2010, was to actually deliberately start running down the medical supplies in Britain that had been put to one side in the event of a pandemic. So as equipment and medications became obsolete, they were not replaced. It was part of the cuts that were going on in public sector medical services. Dr. Bob Gill is a leading campaigner against NHS privatisation and is well known to have been part of really important information that's been disseminated. And it's a great privilege to have you here this afternoon, Bob, in this meeting. How long would you like to speak for?
I was under the impression I'd speak for 20 minutes and then Q&A or whatever follows.
That's great. Okay, so with great pleasure, comrades, I introduce Bob to our meeting. Over to you, Bob.
Thank you very much, Ed, and thank you to Karel for inviting me to come along and speak to you this afternoon. Just a word of introduction. I'm a GP, a family physician, and I've worked in the NHS for the best part of 30 years, and I continue to work as a full-time doctor. My own activism was triggered by a key legislation which went through in 2012, the Health and Social Care Act. And what I learned subsequently was that in this country, we'd undergone a covert and stealth privatization of our health service, which had spanned 4 decades now and had involved all 3 major parties in this assault on the public interest. As you said, you know, the NHS came out of the ashes of the Second World War. It was a revolutionary advance in terms of benefits to the working classes. So you had a major step forward in the circumstances of the working class. But unfortunately, our governments have collectively, since Margaret Thatcher's election in 1979, worked for the interests of global corporations rather than the public. And we're currently facing a new bit of law change in Parliament at the moment, the Health and Care Act 2021, which will complete the privatization. So we've had a series, and this is the final step. What I want to do now is just to take you through a brief history of how the NHS has been prepared for this final step. And the key necessity that was carried out in order to get us to where we are. So we had under Thatcher the creation of a market within the NHS. The ideology was that somehow market efficiency would lead to better outcomes. Well, that was the spin we were given. So you had in the early 80s a marketization of healthcare. We also had the outsourcing, the salami slicing of key functions of a health system, including the ancillary work, the cleaners and the caterers and the portering services. The non-clinical services were hived off under the excuse that this wasn't really healthcare. But we all know without cleanliness and decent food, that's going to affect the healthcare you can provide. It was also necessary as part of this marketization to introduce a hugely inflated bureaucracy to administer what was up until 2012 an internal market, a fake market where there were purchasers and providers. The family doctors were the purchasers and the hospitals were the providers of care. That was the way it was set up. And in order to make this run, you needed a lot of administrators and managers. Now, there's an opportunity cost when you bureaucratize a service. Lots more money goes into running the market. And it was estimated in the mid-2000s, this was around 10% of the total NHS budget. So, back of the envelope calculation in the last 20 years, we have wasted at least £200 billion in running the market. No patient has seen any direct benefit to their healthcare, or has any healthcare worker seen any benefit of that money. It's money totally wasted. It was for the first time, unfortunately, under New Labour in 2000, that we started getting the outsourcing of clinical services, medical services, elective surgery, straightforward procedures, which can be done at huge profit, were transferred over to the private sector. And that was something, the excuse used at that time was it was necessary to engage the help of our friends in the private sector to deal with large waiting lists. The government made a choice. Rather than investing in additional capacity, they gave the work to the private sector, increasing the profits and the stability of the private sector. Now, I mentioned private finance initiative. Private finance initiative was a scam used to saddle the NHS with debt under the excuse of building newer hospitals. But every time they built a new hospital, this was with at least 30% less beds than the hospital it replaced. So private finance initiative was in fact a covert bed closure program because it reduced capacity within the NHS. And we then realized the folly of deregulating the markets. We had the 2008 financial crash and a decade of austerity. Now, this austerity was grabbed by the Conservative Lib Dem coalition to justify cuts to public services. And by the end of the decade, we were 20,000 beds fewer within the NHS. We had built up a recruitment and retention problem in the NHS, resulting in 10,000 doctor vacancies and 40,000 nursing vacancies. And then we had the pandemic. Now, Ed, you mentioned the ignoring of pandemic preparedness. There was an exercise carried out in 2016, the Cygnus exercise, which clearly highlighted the deficiencies in the NHS that had now been built up. Lack of intensive care beds, lack of PPE stockpile, lack of ventilators. Now, all this was known, but the government made a conscious decision not to act to repair any of those deficiencies. So they prepared to fail. They took a decision. It was better to lose life than to reverse some of what they had been doing for so many years. So we entered the pandemic with a staffing crisis, a bed capacity crisis, inadequate protection for the staff, and not enough beds to look after the seriously sick. So how did the government respond to the pandemic? Well, it blocked access to care. It removed the primary care duty of the GPs to triage and look for sick people, and handed it over to a telephone service called 111, which is effectively another privatized entity. So doctors were taken out of the front line of managing the pandemic. A totally crazy act. Other countries expanded their capacity. We, in fact, reduced our capacity even further when the pandemic struck to make space and prevent cross-infection in the hospitals. We cut capacity by another 8%. And we stopped the seriously sick getting into hospital because they weren't allowed in the hospital. They were allowed to die at home. That's what happened. That was our pandemic response. The government decided on a herd immunity policy early on. They wanted the virus to spread around the country. Then they did a U-turn. And again, rather than reflecting on the folly of the privatization and the outsourcing, they doubled down on this strategy and handed over the pandemic response and the test and trace system to an accountancy firm, Deloitte, and an outsourcing giant, Serco, who subcontracted the response to another 30 or 40 smaller companies. So you had a hugely fragmented response, but also a very expensive response, which cost 37 billion over a 2-year period. And the parliamentary inquiry into the test and trace system stated that it failed to make an impact on the spread of the virus. So this was money totally wasted. 37 billion, again, the opportunity cost of that amount of money is huge. We wasted an opportunity to strengthen the NHS and strengthen local council responses to public health, traditional public health, which relied on contact tracing, face-to-face boots on the ground to effect an effective response to the pandemic. And it also didn't, the government chose not to financially adequately support people to isolate because they didn't feel that was didn't suit their political agenda. And what we ended up suffering as a consequence were lockdowns. Now, lockdowns are an extremely blunt tool. They are an admission that we have failed. And who do the lockdowns affect the most? Well, they affect the poorest the most. People who have precarious jobs, no incomes. The essential workers still had to go to work with inadequate protection. And we saw that the pandemic adversely affected the poorest the most. The most deprived communities ended up paying the heaviest toll in terms of deaths of the outcome of the pandemic. The other element of the response was a dominance of vaccination as a strategy to get on top of the pandemic. Now, rather than doubling up with the response with common sense public health, taking mitigation, introducing filtration systems, carbon dioxide monitors within schools, for example, that didn't happen. They solely relied on a vaccine as the way out of the pandemic. And here again, we excelled. We ended up paying the most for the vaccine. The Pfizer vaccine cost under £1 to produce, but our government paid £22 to the drug company per vaccine. The highest price paid by any country across the world for the vaccine. So much for their financial acumen and efficiency. The end results have been multiple secretive, multi-billion pound crony contracts. We learned that there was a VIP lane for people who had connections with the government and the Conservative Party to be awarded contracts, even when they had no experience in providing the service that they were contracted to do. You had overt corruption. You had big pharma cashing up like never before and being granted immunity from any medical indemnity that might follow, any cases that might follow. And you also had a protection of intellectual property to the extent that third world countries didn't benefit from the vaccine rollout. And bringing us up to date, we currently have going through Parliament at the moment a Health and Care Act, which will deliver several things, but the most important thing it will deliver is handing control of NHS budgets to American private insurance giants, particularly United Health and Centene. These are two big insurers with a track record of fraud, a track record of huge profits and excessive pay for their chief executives, have no interest in public health. The bill will deliver control of the budgets, in essence, turning the NHS into no more than a logo and a funding stream. And provision can, on a whole scale, be handed over to for-profit corporations and the budget controlled by private insurance companies, replicating the Medicare Advantage system in America, which is publicly funded, but privately administered and privately delivered. So the end result was laid down by Simon Stevens at a World Economic Forum conference in 2012. Simon Stevens has been the chief executive for the NHS for the last 7 years and now elevated to the Lords. And what he spelt out was the American managed care model, that model where the providers and insurers collude against the interests of the patients. That model was seen as the solution to sustainable healthcare across the Western world. Now, the solution in whose interest? In the interest of the corporations, of course. So what managed care will do, which this bill will enable, is making profit through the denial of care. So these new bodies that will be created by the care bill, integrated care systems, will have a fixed budget. And we already know that they've introduced the insurance industry's algorithms and data analytics to be able to deny care either across these new integrated care systems covering a population of 2 to 3 million, deny it for everybody in that system, and on the individual level based on risk stratification tools, which they will suggest that people won't benefit from the treatment. So treatment will be denied on those two levels. The other thing the bill will do is remove the duty that exists at the moment for outsourcing to be open and public and open to challenge. A section of this bill removes the element for an open competitive tendering. So we will have the normalization of what we saw through the pandemic with these crony deals being arranged behind closed doors. There are other elements to the bill, including the loss of national pay and bargaining rights, a general ability to deregulate the profession so you can institute a de-skilling program, a de-skilling and task shifting program. These are terms the private health industry use to reduce the wage bill by getting the least qualified person to deliver care. So what does this mean to the patients and the professionals? Well, the professionals will be working in more difficult surroundings, unsupervised, potentially working outside of their experience, delivering inferior care. And the implications for the patients are staggering. If, first of all, one implication is you don't get access to care. That care is deemed no longer provided by the NHS. So you either do without care, or you use your life savings to pay for care, or you take out top-up insurance. Those are your options. And that is a major shift from universal comprehensive healthcare, which the Beveridge model provided since the war. The other problem will be if you're getting cared for by somebody not qualified to deliver that care, there are patient safety implications when you do access care. And probably the most stark example will be those who are acutely unwell with a serious medical or surgical condition not being allowed access to an emergency department because they will have to go through this telephone service 111 to get permission to even attend an A&E service. And when you get there, you'll be met by the least qualified person to deal with your care if you get access to it after waiting hours. So we already know, this is not some hypothetical, we know from a study done by the Royal College of Emergency Medicine that in the last year, over 4,500 patients died as a consequence of overstretched A&E departments, where ambulances weren't able to offload their patients into the care of the medical teams, and patients were languishing in the back of ambulances. Meanwhile, those ambulances tied up at the hospital were unable to go and get other sick patients to receive care. So that's 4,500 patients within 1 year, down to the overcrowding that we already experienced, and this is set to get worse. So that's really bringing you up to date. And what I've described, what I've set out, really is an assault on our health service, which to the financial interests is really a profit stream. And the profit stream is being tapped into, be it the land and the property, so the transfer of ownership through PFI from the public sector to the private sector, be it the patient data, which has enormous commercial potential going forward, and what I've outlined with the bill, control of the budgets. That is the key with this bill, control of the budget, so they can siphon away money from the delivery of patient care. And that's what we need to be most wary of with this bill. Thank you.
Thank you very much, Bob. That's a very comprehensive summary of some of the really important things that I think staff in the health service must be acutely aware of, and patients probably gradually beginning to discover as they go through some of these difficult and changing arrangements in the health service. Thank you so much for introducing that. Now the floor is open to the meeting for comrades who wish to make points, ask questions. Yes, I see Peter. Peter, it's over to you.
Hi, thanks, Ed. Thanks, Dr. Bob. It seems to me we're heading quickly into a health service that's going to be privatised. The cost of the insurance to those who are elderly, disabled, and those with illnesses, it's going to be prohibitive. Now, recently, I had to take court action against the DVLA. As a result to prove my innocence, I had to pay privately for 2 consultations and a blood test. The first consultation cost £110. It lasted 25 minutes. The blood test cost just under £53. The second consultation took 7 minutes, but it still cost £110. So that was £273, almost, well, not much more than half hour's work, lab work, of course, and the nurse that took my blood test. If that's repeated for somebody with serious problem, I would say that the insurance for that person is going to be such high cost. It's a simple case, they'll not be able to afford it, and it'll be left to rot by this rotten government. Some years previously, about 4, I think, 5 perhaps, as a result of a disability, I've got mobility problems, serious mobility problems. We decided, me and my wife, to have a trip to Isle of Man. I've been inquiries, bearing in mind the Isle of Man has a health arrangement with the British government as to how much a 5-day, 4-night cost of insurance would be. I was astounded. £276 I wanted. That was almost the cost of one of the holidays for us. It's hideous. That was then. So heaven help anybody who has got a disability, who has got illness, who has elderly. I've got a funny feeling we're going to have a lot more people dying as a result of the incompetence and rottenness of this capitalist system and the government we seem to have in this country at the moment. Thanks.
Okay, so Felicity, your hand is next up, please. Over to you.
There's a really big campaign against this, the health and care bill, and against what the government are doing to health taking place across the country. There's a I've just put in the chat the link to a meeting on the 19th of January, which is trying to coordinate the different groups in a big campaign towards a day of action on February the 26th. So the core thing that there are people all across the country fighting this is really important to know. This is not being let to go easily. Bob is an excellent source of information on what's going on and keeping us all well informed on what's going on. And I want to talk mainly about the actual campaign. Now, Ed said that NHS staff must know all this. It's far from that. A vast number of NHS staff know there's something wrong, but have no idea of what's going on in terms of the bill, in terms of the ICS system. The NHS is going to be split, or it's happening ahead of the legislation, is being split into 42 different areas, each of which will have a different budget, provide different services, have different standards, probably different rates of pay. This is the biggest privatization ever. And it's hugely profitable for the companies involved in it. But the government never admits properly what's happened. I can't remember exactly when, Bob might remember better than me, but there was the previous health secretary, Hancock, did announce in Parliament that those who wanted the NHS to be a public service were just ideological, that then we had to accept the role of the private sector in it. So they're beginning to be more open. Alex Scott Samuel has done a lovely little video, and again, I'll try and put a link into it, where he explains how it goes right back to Thatcher. But the thing is that Thatcher was too scared to do it. This lot think they can get away with literally with murder, and it is literally murder, because the life expectancy is falling and life expectancy in good health is getting worse. And we have a report came out on the weekend saying that the government could save 30 billion in costs if it raised the standard of health of those in the poorest areas of the country. Fighting for good health is an investment. Health spending is an investment, not just a spend. The other thing I want to say, and I'm going to be saying this a lot to a lot of people, so I'd appreciate some help from Bob in saying this, is when you talk about the NHS, you've got to talk about maternity. The maternity system in this country is breaking. I was on a meeting last week with Dr. John Puntis from Keep Our NHS Public, who's a retired consultant, who told us of his niece giving birth in a hospital without a midwife present, and they finally rustled up a nurse. Nurses are not trained in delivery of babies. There is scandal after scandal after scandal in terms of the poor state of maternity in this country. And there is no need for it to be like that. Midwives are leaving because they can't stand the pressure of the job, and they don't want to be the person who's responsible for a mother or a baby dying, or a mother or a baby being badly hurt. They can't take that pressure, and they're leaving. We were on the streets yesterday. We had a great time in Liverpool campaigning for the NHS yesterday on the streets. But a midwife stopped to talk to me. She was saying that she'd just come off her fourth 13-hour shift, 4 days, 13 hours, and was supposed to work a fifth, and had just told them she couldn't do that fifth because she was just too physically exhausted. We have a genuine crisis in maternity, and we've got to make sure it's mentioned in everything. The other thing we've got to mention is the fact that mental health has been stripped out of the NHS. Most mental health beds are now provided privately, mainly by Spire. But just as the care of people with learning disabilities was outsourced years ago, along with the care of the elderly who need residential care, The stories, the scandals just roll on, but many people simply can't get mental health care. There is no shortage of people out there campaigning for the NHS. And if you want to raise your spirits, if you want to see how some people genuinely support our ideas, get out on the streets and do it, because you come back, you know, really enthused from it. The unions are beginning to shift, but most of them signed a document supporting the bill. And we are fighting a battle to overturn that. Unison in particular has a disgraceful stance on it. The ICSs are being implemented without legal say so, but it's going ahead. They're employing, you know, chief executives on 270,000, 230,000 kinds of wages. And private companies are going to sit on those ICS boards. So we've got to fight in the unions. We've got to fight to keep the campaign going. And Labour, frankly, is hopeless on it. I've forgotten his name. Wesley, somebody came at one of the bright sparks of the younger right wing in the Labour Party, said, oh yes, we're going to use the private sector. The private sector's been bolstered in their billions by this government. I'm not going to continue, but there's a fight on there, and it's a major fight, and there's similar fights going on across Europe. So thank you. Join the fight.
Thank you very much, Felicity. I can confirm that whenever I've been out on the street supporting the NHS, the support from the public of a public health service is absolutely overwhelming. Leslie, you're the next speaker. Leslie Mahmood.
Yeah, just on Simon Stevens, first of all, he actually went off and worked as a CEO in US healthcare. So, and the whole 5-year NHS plan is based exactly on that, you know, as Bob mentioned. And the health and care bill, it is so dangerous because before the pandemic, the NHS, you know, had suffered, and I'm sure Bob went through this, you know, years of cuts in beds, freeze in pay, and PFI. So in Liverpool, for instance, we have the ongoing scandal where this PFI hospital was supposed to be finished several years ago, and it still isn't complete, and it's a complete drain on money. And the hospital it's meant to replace, which is in front of it, it looks like something out of, you know, an undeveloped country slum. Obviously, the health service as well was understaffed previously, 40,000 nurses short, 3,000 midwives short, just to name a few. And so obviously when the pandemic hit, it hit really hard. And I think one of the things that we've got to counter is this idea of a lot of the headlines now as, you know, the NHS is failing, but the NHS has been set up to fail. And obviously the health and care bill is being slipped in behind the scenes. And as Bob says, it's extremely dangerous. But the fact that the NHS is in crisis, you know, is being used to justify, oh, we're going to, you know, we're going to make the NHS fit for purpose. So the 40 regional integrated care systems have been mentioned, and the significance of that is not only will we have these private companies on various decision-making bodies, so not just getting the contracts, but deciding who gets the contracts and who gets the treatment. It won't be a national service anymore. And these systems are already in place. As Felicity said, they're not actually legal yet, but everything's been going along the last few years. And one of the things that Bob mentioned was about there's no automatic right to emergency services in this bill for everybody who happens to be in that ICS at the time. And already in the Greater Manchester area, there's been a case recently where somebody who had accidentally scalded herself, and ironically she happened to be a nurse on who was away for a couple of days. She was actually turned away from an A&E department and sent back to a local health centre because she was told, we don't deal with your postcode in this hospital. And so you could just, you know, that's a kind of sign of what's to come under this health and care bill. Already locally in the, as part of our Save Liverpool Women's Hospital campaign, we've alerted people to the fact that the already Liverpool Women's Hospital, which is to the forefront of the vanguard of this ICS system for maternity, has been developing personal budgets in the local women's hospital so they can figure out exactly how much it costs for any kind of treatment. And obviously the idea of that is then you can actually start a paying system. And already we have a paying system for migrant charges for the NHS, which again has impacted on many people, including 3 pregnant women who actually died because they were too terrified to come forward and get treatment because they were scared of charges. You could pay up to 3,000, 6,000 or more for you know, for a birth. So, and Felicity's mentioned the scandal in the crisis in maternity. There was another scandal in the headlines on you know, on Friday. 29 out of 30 midwives leave after their training, and 50% of midwives currently want to leave. And we know that there's many GPs, there's many hospital doctors, there's many nurses who are so worn down by the pandemic, so insulted by the lack of a pay offer, that they're seriously considering leaving the health service, and will if the impact of compulsory vaccination. And Bob, I'll just finish on this last 2 points, that Bob's mentioned about national pay and conditions will go out of the window because these regional bodies will basically decide on pay and conditions, and that's part of this health and care bill. So finally, as Felicity said, we have been out campaigning, and we've been trying to link up as many areas of the Northwest as possible. And one of the things we've done is leaflet the hospitals early in the morning, because many staff do not know, you know, a lot to do with their unions not telling people what's happening. But again, you know, we do have to let people know what's actually happening, and also that there's an alternative. With the 5th richest country in the world, of course we can afford a national health service, of course we can afford adequate maternity facilities, of course we can afford a decent ambulance service, a hospital service, but we just can't afford a privatised system. Thanks.
Thank you very much, Leslie. Next speaker is David Hempson.
Comrades, I want to thank Bob for, you know, a really interesting introduction, and then try and you know, open a bit of a debate about what we see you know, globally. You know, the first point I would like to deal with is that even in the ongoing crisis of capitalism, that productive forces are developing at an unprecedented rate. And this pandemic actually, the response to this pandemic actually shows some evidence about that. But it shows that absolutely the productive forces are spilling over from the national state. That's history. But the benefits of that development of science and technology are being appropriated by the capitalist corporations and through privatization. And that's the issue, I think. Because I do think we need to stress that it's not the corporate bodies that have come up with these massive innovations. And I think we do have to know that there's a revolution in science taking place. It's unprecedented that there would be a pandemic of this kind, and that within 9 months, there can be a vaccination. That is unheard of. Just remember that we've had AIDS with us, HIV AIDS as a disease among us for the last 35 years, and there is no hint yet of any vaccination. We've got tuberculosis, which has been with us for more than a century, in the way and the various forms in which it is presently. And it is killing our people in Southern Africa, as well as HIV/AIDS. And there is no vaccination, for that. And neither is there vaccination for malaria. In other words, what's happening is that the corporate bodies are seeking profits, mainly in the advanced capitalist countries, although they'd love to take whatever they can from the global south, and then is appropriating all the advances in technology and science and technology, patenting that, refusing to share patents, and keeping this pandemic alive. That's what's happening, because there is no solution in one country. We need to repeat that, because really often nobody starts with a global assumption. The global scientific fact is that if there is no intervention in the global south, where 2/3 of humanity live, there will be no resolution of the COVID pandemic. That has been proved because just about every variant which has come about has come from there. And that is, that's a simple fact. And the innovations, the scientists who have advanced the science and technology and been able to do these rapid turnarounds are like the Turkish couple in Germany, who did the original research based on the scientific development elsewhere. It wasn't the corporate bodies. They have appropriated that research, and that's what's happening. There's also been a revolution in peer review. In the past, it would be impossible, to have medicines, different drugs put on the market without years of research. Now, through accelerated peer review systems, it's just possible to be able to get scientific conclusions within 3 to 4 months. That's unheard of, previously. So there is a revolution in science taking place, and I think we have to, that's part of the argument we need to make. That is being that is often supported by the state, but the appropriation is by private enterprises and corporate bodies, and that's where the profits are being made, and that's how they, clamping down on privatization. But we see that, a pretty dismal picture, because now the evidence is that there's a declining life expectancy in Britain, as well as in the United States. This is phenomenal. This is unprecedented in the last a century or two. And the diseases are those of obesity, of diet, of diabetes, and of course now of COVID, because COVID then is the knockout factor, for people who already have some existing disability of this kind. Now, what I think we need to come up and see from all the evidence that Bob's given and everyone else is that the private model, the idea that health can be provided on a private basis, is actually collapsing at the moment. There's a shortage of nurses in the States, and people are so exhausted through the COVID pandemic that they are not prepared to go into the hospitals where they are not properly protected, as well as the poor conditions and all the rest of it. And so they say that worldwide, some 20% of the health workers have actually died from the pandemic. Imagine that. You're putting yourself on the front line every time you go into a hospital. It's a center of a disease, as we know. I've had my godchild actually got a disease from a hospital in London. And that is the level at which there is such poor conditions, I mean, in the possibility of getting infection from hospitals. They're a center of infections, and that could readily spread. So in other words, we need to make clear that the private model is actually collapsing. They've tried it. It's extremely expensive, it's extortionate for people, and it's not working. So we have to fight against the demoralization that there is among workers who are serving in the sector, to be able to inspire them that another alternative is alive and well, and fight as vigorously as possible, for not only at a national level and not at the global north, at the north, Something like 80% of the initiatives which have been taken in the pandemic and on all health systems are in the global north. There's nothing happening of any effectiveness, in the south. And we're looking at the moment of 6% vaccination in the global south as a whole. And people, the World Health Organization is appealing, to corporate bodies, appealing to the capitalist states. Please do something because it's in your self-interest. Whenever has capitalism really worked in its self-interest? It doesn't work that. Marx explained that in Wages, Price, and Profit, that everybody, all the capitalists would benefit if wages were higher, but no one's going to initiate that. And it's the same in relation to the vaccination. They insist on getting the money from the patents, on holding fast against that, and maintaining the level of disease throughout the world. So we need to overthrow the system. Thanks.
Thank you, David. The next speaker is Steve.
Yeah, well, first of all, I want to thank you for having this important presentation. I was in a little late, but this is something that the American working class need to hear. And one suggestion I make is to get a text of these presentations. The script is a software you can get that would allow you to get the text of this, because I think the lessons of your struggle to defend the National Health Service are important for the American working class. And of course, American companies, Pfizer in the Bay Area, are trying to privatize the healthcare system to bring the great gains of the American healthcare system to Britain. So I think it'd be worthwhile to get this out. But what I wanted to say is this pandemic, as have all pandemics, shows the contradictions in the system, the failure of the system. And for the American working class, this has been a catastrophe because you have privatized healthcare. Even in the midst of a pandemic, you don't have national healthcare. And in California, where the nurses union, and there's been a movement for a single payer, the Democrats, the capitalists, don't want to implement national healthcare. So there's a struggle inside the unions. In fact, the National Nurses Union, which is one of the most militant unions in the country, is fighting the Democratic governor Newsom now over the fact that he won't support a single payer healthcare system in California. So I think also that this actually is having a traumatic effect. This pandemic, the virus, and the failure of American capitalism is having a disastrous effect, obviously not just on the working class as a whole, but healthcare workers and schools. In the schools in the United States, they want the teachers to be the healthcare workers, to do the testing and to see if students do not have the virus. So it's creating a catastrophic situation in the working class in schools and education. So I think, though, that the potential of a fight for a labor party, of socialism, is more greater today than ever in the history of the United States, because the collapse of the healthcare system in the United States, the complete disaster that it is, and also the question of the drug companies, because as David said, and I agree with him, they want to keep the virus going because it's a stream of revenue, an ongoing stream of revenue in the United States. And the US government, Pfizer has got $36 billion from the US government for drugs that were developed by US government grants in many cases. So these drug companies, Big Pharma, actually is to the benefit to keep the drugs, the boosters, more boosters, an endless stream of boosters. And that has created actually a backlash of people who are saying they don't trust the government, they don't want any mandates, and the vaccine is, they don't believe in the vaccine, because the policy of the capitalist is to, in the United States, the Democrats, that is, not the Republicans, is to say the solution is vaccines, not public health care, but vaccines. Just get more vaccines, and that'll solve the problem. Of course, you need a public health policy, and vaccines are not going to solve the problem of a pandemic and a virus. So I think socialist revolutionaries have to make that clear, that there is a public health policy, which the capitalists don't want to have because they want to keep private control of healthcare and the hospitals and the drug industry. So I think that the potential on a global level is for a socialist program for healthcare. which the working class around the world see that they can't solve this problem within the framework of capitalism. And I think that is a great opportunity. So I'll get this video out among healthcare workers in the United States, because we have to make this a global discussion. In Taiwan, for example, they have a zero COVID policy. Now, China, despite our disagreements with China, actually has tried to shut down the virus. That is a gain. That's something that should happen in the United States. It is happening in Taiwan, and we interviewed some healthcare workers there. So there is a solution, and I agree with David again. It can't be a national solution. It has to be a global solution. It can't happen when you have capitalists control the drug industry, when you have capitalists control the healthcare industry. They're not interested in it. So I think a global program to deal with the pandemic, a socialist program for the working class globally, is critical to develop. And I think the discussion you're having here, we need to get that out internationally to healthcare workers, particularly to look at the experiences and lessons of the struggle to fight privatization and the destruction of the National Healthcare Service in Britain.
Yes, thank you very much, Steve, and David, for bringing in this international dimension to this discussion. It could become very NHS focused, and of course, this is certainly it's a global pandemic, and the fight for public health care, as comrades have illustrated, has to be global. Now, I'm going to go back to Pam to ask Pam if
can you hear me now?
We've got you, Pam. Welcome to the meeting.
I just have to
audio.
go out and join.
Okay.
I don't know what's happened. It's never happened before. I mean, the scandal of these vaccinations at £22 a head is just throwing hundreds of thousands of pounds of worth of them away now, because they're coming close to their expiry date. So not only is there absolute fortune being paid for them in the first place, they're being disposed of. They're not being sent anywhere. They're just being thrown away. But that wasn't what I came on to say, really. I just wanted to go back to what Felicity and Leslie were saying about the campaign. I got involved as a group of us campaigning in Lancashire, and we went around different town centres and set up a stall, either outside or as near as possible we could to the Tory MPs' offices. Comrades may not be aware of the fact that Lancashire would normally be all Labour MPs, and all these Tory MPs are sneaked in now after the chaos of the last election. But anyway, we went and stood outside their offices. The idea was to give them an embroidered handkerchief. People have actually sat embroidered these things, about defending the NHS and keeping it as a free service. And interestingly enough, we were in Burnley, and I think it's Sarah Brickcliffe in Burnley. We were outside her office. We set up a street stall. We did loads of campaigning. We're getting people to sign signatures. And then we went to knock on the door of the Sarah Brickcliffe's office to give her this handkerchief, and she won't come out. Anyway, after a bit of a carry on, the handkerchief got handed in, but then we got accused of harassment. And this is simply wanting to speak to the local MP. We found with the street stalls, it was quite a mixed reaction, really. Some of the most apathetic people were NHS staff. Some were scared. We can't get involved in that. We're not allowed to. But they were incredibly apathetic. And one guy more or less accused me of creating a conspiracy theory about this, this privatisation of the NHS. And it was just incredulous. We were incredulous, how oblivious some people were. But on the other hand, we went to Rochester, which is my local town, and people were queuing up to sign these petitions that we were going to send to the MP and the local council, and they were absolutely outraged. And although they weren't very clear about, what was going on, they were certainly knew something that was the matter, and that quite a few people said, "I'll sign that. I'm absolutely sick of what this government are doing." So there's kind of a mixed reaction, with some people oblivious and other people fighting on. Now I'm told that the results of this taking these of the campaigns we did in these Tory MPs areas is when the first reading of the bill, a lot of them actually abstained, which is rather interesting, because these MPs, they're in constituencies with very small majorities and have no right to be there, really. So we were sort of we were playing on that, and that was the outcome, that they were actually abstaining on the bill. So it could well be, we had some effect, but we certainly talked to hundreds and hundreds of people, and you can't beat getting onto the street, getting into the shopping centres and actually talking to ordinary people. Just a couple of final comments, really. The business about the midwifery service is absolutely horrendous. If a baby is neglected at birth and is oxygen starved, it then costs the state an absolute fortune in all the additional support. I had a disabled child, not through a birth injury, it was a physical disability, but it cost an absolute bomb for wheelchairs and sports at school and special transport and all the healthcare and all the rest of it. And it just does not make any sense to not look after a baby at birth, even not from a financial point of view, because that will be a lifetime of disability and a lifetime of expense. And just one final point, the dentistry service that nobody's mentioned yet. I broke a tooth at the end of October. And I rang up to have an appointment. So the first one they could give me was the 26th of January, which is absolutely crazy. So, you know, you're sort of seeing it going on all over. But I mean, I do think we have to keep on campaigning. The penny will drop eventually. Whether it's going to be, well, it's never too late in a sense, because only a change of government can do anything about this, really. But I think we just have to keep going with it, really. We certainly have to take it forward to what the last speaker was saying. You know, we need a socialist policy on health based on need, not profit.
Thank you, Pam. A lot of what you say resonates with me, especially being out on the street and people queuing up to sign petitions. It's a very good issue on the street for campaigning on. Next speaker is Finn.
Okay, comrades, I want to begin by thanking Bob for a very interesting, very illuminating opening contribution, and the contribution other comrades have made about the campaign to save the NHS is interesting also. In Ireland, we have a two-tier system. If you've got money, you can jump the queues by joining a private health system, which costs, by the way, up to €2,000 per year to join the insurance company. And then instead of waiting 2 or 3 years to see a consultant, which you would under the public system, you pay your annual fee and you get to see the consultant within 2 weeks. It was interesting, Peter's mentioned about paying €100 to see a consultant. It costs us 250 here for your first consultation. But the point I really want to get back to is the point that Steve and Dave raised about international lessons of this. There's a bonanza literally being made by the big companies, Pfizer, AstraZeneca, Johnson, Moderna, a bonanza at the present time. The sales of drugs are guaranteed. Governments are buying the products of these companies, and the profits are guaranteed to them. I saw recently there's a move on the board of Pfizer, a proposal coming forward, that Pfizer should open up the licensing arrangement to enable production of drugs at a lower rate in the underdeveloped countries. So even at the level of the capitalists themselves, there's unease about this. But the production, it's true what Dave has said, that university support for research is where the drugs came from. There was government-supported research in universities. And then, for instance, AstraZeneca developed in Oxford. When the drug became available, then it went across to the company and they took over the rights to sell it and market it, and same as Pfizer. So the work of developing and inventing these drugs is done at public expense. And then the private companies are then given free rein to sell and market. The same is true, by the way, for medical devices and PPE and stuff of that nature. It's a guaranteed market, which is handed over to the private companies. But that's a very general point also. It's not just, it doesn't just apply to drugs and to medical equipment. It applies everywhere. In every company where a new product is developed, whether it's a car component or a drug, it's the workers in the company who develop and invent and create that new product. And they're paid as scientific workers in the company or whatever their status might be, but the product belongs to the board and to those who have invested and the shareholders and so on. So all the work of developing and inventing new products, as Dave has alluded to, the advances in science, is all done by workers, scientific workers, PhDs and so on. I remember myself applying a few times for jobs in various companies where they had a research department developing new products, which then, once you develop a product, your wage doesn't change, it doesn't belong to you, it belongs to the company. So we need to bear that in mind. But how do we approach this? There used to be a demand to nationalize the big companies. Now, if you put that demand forward, for example, in relation to Pfizer, to nationalize Pfizer, I mean, which country, which nation nationalizes Pfizer. And the complexity of the situation requires an international response. Now, there's a big international meeting to discuss the environment up in Glasgow there some months ago. We need a labour movement international meeting to discuss issues of this nature, because it's the workers and trade union members who develop the drugs and develop all the products that are invented by capitalism. It's not a capitalist system, by the way, that invents new products. It's the worker in the industry, the scientific worker invents a new product, but a product then belongs to the capitalists. And as Dave was saying, the capitalist system allows this procedure to go ahead, enables it to go ahead, because they're the ones that are paying the wages. But the actual invention and the creativity is coming from the workers in the companies. Now, there are international labour organisations such as the ILO itself, which should meet to discuss this question of the labour of workers being exploited, particularly now by drug companies. There's also organisations like the European Trade Union Congress and bodies of that nature, which should now be discussing this question of exploitation of human labour in such a way that when the new product, and in this case the drugs of Pfizer, AstraZeneca, Johnson and Moderna, when these drugs are developed, the product belongs to the company, and that needs to be resisted. At the very least, it needs to be discussed openly, and I think we should put that proposal forward, that this discussion takes place internationally. Now, the COP event in Glasgow, interesting though it was, is really governments. It's capitalist governments coming together to see how do we lose most? Do we lose most by continuing as we are, or by making changes to the issues that we deal with in terms of the environment? But this should be broader. This should be a discussion of the rights of workers in companies and the product of the labour of workers. In the particular case of drug companies, that's what we're talking about now. That needs to be discussed within the international labour organisation. So I suggest as a proposal, we might look at that. I mean, Steve is right. We have the same issue here in Ireland. We need to have in Ireland a national health service such as was developed in Britain after the war. We never had that. There was always a two-tier system here. You pay to join the private company, and then you pay extra on top of that then for the various treatments that you get. At a reduced rate, like all insurance companies, you don't pay the market rate, but you pay for every service you get companies. That have been international discussion in the labour organisations about how the labour of workers, in this case scientific workers, has been appropriated by the companies, and then enormous profits have been made and shared out to the shareholders of these companies who have no involvement or knowledge or anything whatever to do with the drug development. Nonetheless, reap all these profits. And with the guaranteed sales now, because governments are purchasing the drugs, it's a bonanza time for all these big capitalist companies.
Okay, thank you, Finn. Next speaker in the discussion is Mike Higgins.
Hi, it's actually, there's actually two of us here. There's Mike and I'm Mike's partner, Linda. I just wanted to say brilliant presentation by Bob, as usual. Bob came along to our CLP meeting and nearly caused a riot, but that's another story. I would just remind people that the NHS, since its inception, was never really 100% public. GPs were, GP practices were owned privately, and there was never a publicly owned pharmaceuticals company. Mike and myself are both disabled people. Yeah, I was just gonna say that over the years, I've seen all of the services that I rely on as a disabled person privatized. And I think when we go out and do our campaigning, we do need to explain to people that many of the services that they use, many of the health services that they use are indeed already privatized. If you need an eye test, you now have to go to somewhere like Boots or Specsavers. If you need dental treatment, very, very often you have to go to a private dentist. because you can't get, certainly can't get emergency NHS dental treatment. And I think that the public, they don't really think about the privatization of the NHS in that way. And they don't think about the fact that if they are found to have cataracts and they're told that they have to wait 6 months before they can get any treatment, or they have to wait for their eyesight to get worse, and they end up actually paying to go privately, they don't put all of those different things together and see the slow erosion of our National Health Service. So that's what I wanted to say. I don't know if Mike wants to add anything. No, he's fine. Okay.
Okay, thank you very much, Linda. Steve has just put his hand up again. I'll call you in, Steve, as there's nobody in. Please come in again, and then we'll probably go to Bob.
Yeah, I think, this is obviously an international issue, but I think we have to have unfortunately, because of the divisions in the international working class movement, there is no clear program agenda for workers' controlled socialized healthcare globally. And that's a political problem, which has to be overcome because it's a global issue, and we have to link up, particularly healthcare workers globally, together to fight this. And the unions, I know the National Nurse Union has a global network of nurses unions, but we need to begin a debate internationally among healthcare workers about the need a global plan for workers' controlled socialized healthcare on a global level, and nationalization of the drug industries. The other thing is, I think we also have to address the issue of the right wing, because there's an attack on science in the United States. I mean, you had the most obvious one of Trump saying that you shouldn't take vaccines, and now he's changed his position. But you have millions of people literally in the United States who don't believe that you should take vaccines, and also that vaccines are. There is a plan by the capitals to use, and this is the other aspect which has not been brought up, and that is technology and information technology, using the vaccines in the health crisis as a way of tracking people. And this is the case in China as well with the identity card. And companies are making massive amounts of money on that with the passport, ID passport. So the right wing is using this internationally as well to organize. Fascists are using this in the working class against the governments. They don't say, of course, that the governments are controlled by the capitalists, but we've got to fight governments. In the United States, they call the government a communist government. I mean, this is Obama was a communist, and Biden is a communist, controlled by communists, and that's why they have mandates, and they're pushing this. So I think that's another aspect, what the right wing is saying, and fighting that politically. It requires a global socialist solution. So in any event, I think we need to, how can we organize this internationally? What unions in the world are fighting for a global solution, a socialist working class solution to the pandemic and the healthcare crisis? That's what we have to look at. We have to begin a debate globally on how to bring this about. So maybe having a panel of healthcare workers around the world talking about the socialist solution and the particular problems in each country. So I think that would be a possible avenue to take this discussion forward, because I do think it's critical. So the other thing I wanted to add, and I put it in the chat as a notice, is that I'm working with, as well as David, with the South African unions who are fighting for the clover workers. And there's a strike of 5,000 clover workers since November 22nd. And the South African Federation of Trade Unions, the General Industrial Workers Union of South Africa, and the Food and Allied Workers Union tomorrow are going to be having a press conference and calling for an international day of action at all Israeli consulates and embassies around the world on January the 25th. And we are also here in the United States going to target the bank that this Israeli billionaire family owns, the Wertheim family, and also Coca-Cola, because this family who had bought the Clover have the license for distribution of Coca-Cola in Israel. So there's a possibility of an international campaign globally to unite with the South African working class and support the Clover workers, and also take up the role of the Zionist government in Israel and build some unity globally. So I would urge the comrades to either get in touch with me or David so we can help build this International Day of Action on the 25th. I think it could be very positive. That's it.
Okay, thank you very much, Steve, for that important contribution. So, Bob, you've got as much time as you want to respond to what's been said, and then I hope we can find a little bit of time to talk about concretely about next steps that comrades in this meeting can be involved in. So over to you, Bob.
Thank you, Ed. Just to pick up on a few of the points. So there wasn't much I disagree with in terms of what I heard. The objective, there's sometimes an accidental misframing. The objective of what's happening to our health service isn't to make it work better for the patients, and it isn't to drive down costs. It's to do the exact opposite. It's to avoid very sick people because they're expensive, and it's to drive up costs. So we're heading towards doubling our healthcare expenditure, just like America. Half of that will be made up by public expenditure, and half will be made by private expenditure. But the total cost is set to double, and the quality will go down. So we've heard about the collapse of midwifery services. Well, extend that to all A&E services, where you will get skid row services if you happen to be very ill, because in the acute situation, that is risky and that's potentially expensive, and the private companies don't want to offer it. So there's a shrinking away of emergency provision and the quality of that provision. In terms of campaigning, we need to be wary of why the campaigning has been so utterly unsuccessful to date, and that is because of the co-option of the union movement. So within healthcare, the big unions, Unison, GMB, and to lesser extent Unite, have not said one useful word to their members about what's going on, because their members are going to be affected. The quality of care their members are going to be able to offer is diminishing. They're going to be working in unsafe environments, and their terms and conditions are going to get destroyed. Now, why wouldn't a union make those arguments to their members? It's unforgivable. We have also a very similar trajectory in the States. We have two neoliberal parties. Keir Starmer produced an opinion piece in The Guardian, I think it was published yesterday or Friday, reiterating the privatization lobby's talking points and never mentioning for one instant the threat of the bill, which is to hand control of budgets over to the private insurers. So he was talking about partnerships with the private sector, need to do radical reform, have a look at the system. This is what comes from the privatization lobby. These exact same points are coming from there. But the medical colleges, the British Medical Association, the Royal College of Nurses, Unison, have all signed up to the bill, although belatedly they have some minor objections to the bill now, right? As just to pacify their members. So we need to be savvy enough to know that a lot of the people that should be fighting this battle aren't fighting the battle. And the problem isn't the memberships, it's the leaderships. So whatever opportunity we can to have pressure on the leaderships, expose the leaderships for acting not in the interest of their members, challenge the leaderships. We need to press these people and not just keep our fingers crossed, hoping that they'll come to their senses. Up until this date, they've actively been against the interests of preserving a nationalized NHS. I just want to touch on the point on the vaccine and the threat of the mandate for healthcare workers. So we've seen an exodus of care workers who are mandated to have the vaccine, and we may see an exodus of healthcare workers. There's around just under 100,000 healthcare workers who are unvaccinated. That's 1 in 10. So 90% are vaccinated. There is no evidence that if you are vaccinated, you have a less chance of being reinfected. So that's clearly established. There is no evidence that should you be reinfected after vaccination, that you are any less likely to transmit it to others. So the rational argument for a mandate does not exist. So we need to ask ourselves, why is the government pushing for a mandate? And the reason they're pushing for a mandate is because they're also pushing for a passport, on the back of which will be developed a social scoring system, and in due course, access to public services, and maybe access to the financial system. That's why they're pushing this totally bogus argument about a vaccine mandate. And it's in their interest to drum up fear and to coerce people into adopting the vaccine. I'm not doubting that it's an important thing if you're a vulnerable person, but individuals should be allowed to make that risk assessment for themselves. And if you've had the infection, then you do have natural immunity, and evidence is coming out that is superior to vaccine-induced immunity. So there are many arguments to be made, but certainly mandate is not justifiable. And the final word about the effect of this on staff, well, if you think about who in the health service might put more resistance to the privatization, who are the critical thinkers, who are the people willing to take a principled stand? They happen to be the same people not wanting the vaccine. This is a terrific way of getting rid of resistance out of the NHS. So there's another way of looking at why they are pushing this mandate down our throats. In terms of public investment and private profiteering, well, that is the model. Now we have a corporate state model where the public invest and the private reap the rewards. That's the way it's designed now, and it's becoming pretty blatant. And the government is busily selling off or privatizing the vaccine manufacturing facility that we do have currently, which is publicly controlled. So the idea of a nationalized pharma industry is a great one. So we have to also be mindful that in order to make profit out of healthcare, you have to rig research, you have to co-opt the regulatory bodies, and you have to bribe doctors to go around advocating for these treatments. And I'll give you two examples: metallic hip replacements and vaginal meshes, and there are various drug scandals that have arisen over the years that were heavily promoted and not very well monitored and have ended up being a healthcare disaster. So we need strong regulation. We need it to be truly evidence-based, and the evidence that we incorporate into making policy decisions should not be funded by the drug companies that are going to profit out of rollout of their products. So, you know, these are basic mechanisms to remove conflicts of interest. So we get developments in healthcare that are actually designed to benefit the patients and not designed to extract as much profit as possible. So that's where I am on just picking up on those points. I think we also have to convince people that a nationalized, publicly provided system is in the interest of the middle classes who think they can afford to buy themselves out of the NHS. Because when they become seriously ill and potentially very expensive to their insurer, the insurer finds a way to dump them. So a strong public system is in everybody's interest, rich or poor. The rich are also the targets of unnecessary medical treatments, operations they don't need, medication they don't need, because the providers of healthcare have a profit incentive to overtreat. And the third biggest cause of death in America is medical error, because they have a fragmented system which doesn't look after the patient's interests. It's all about returning maximum profit, be that for the hospital provider or be that for the insurance company. And the patient is stuck in the middle. And it's an absolute nightmare that we are replicating at the moment. Thank you.
Thank you very much, Bob. There is this question, next steps. Felicity, would you like to say anything to the meeting? I mean, I know you've got some very important campaigns going on in Liverpool that maybe the rest of us could learn from. So would you like to say something?
Yeah, thank you. I really do think it's important that we don't just discuss things and think, oh, isn't it awful? Hearing what's going on should be a call to action. A quick thing of what we've done locally. The Merseyside, the Cheshire and Merseyside area is physically the largest ICS area in the country. And what we've done is we've got the trades councils from all across that area. One by one, we've got them to agree to join the campaign. We've got all the health campaign groups, the Save, Defend Our NHS, Keep Our NHS Public, Socialist Health, all the health campaign groups we can get together to work together as one group across the Merseyside and Cheshire area. And it's from that Pam's, it kind of spilt into the work that Pam was doing through a comrade called Mary, who took it out into a lot of other areas. So that's the way we've worked it. And that to an extent counters what's going on in the unions. Bob is very correct that the union leadership, or certainly the union leadership that's kind of moving out now, did not understand or chose to cooperate with privatisation. We have had some success with getting Sharon Graham to take the issue seriously, although she doesn't focus on it. And we need to put more pressure on her. If any of you are in Unite or Unite Community, putting pressure on her, emailing her, getting resolutions through is desperately important. But of course, Unite is very small in the health service. It's a very small segment of it. Most health service workers, apart from doctors, are in Unison. And Unison, there's a fight going on at the top of Unison, but Unison have not even told people what's going on. And they are very remiss. However, and some of you will go, oh God, no. Getting up early in the morning, and I mean early, to catch the workers going into hospital for the morning, for the day shift. You have to find out for your own hospital what time that is. It can be anything from 7:15 to about 7:45, but it's really early. But once you've leafleted them twice, they start treating you as part of, and don't try and throw you off. But that leafleting the hospitals is very important. There's a National Day of Action on the 26th of February. Now, I'm glad Bob said what he said about the union leadership, because otherwise you'd have thought I'm paranoid. The union leadership are involved in this Day of Action called NHS SOS on the 26th of February, but they are not mentioning the core issues. I think we should try and intervene in that Day of Action and make all core issues are raised. No, sure there are other that will be done well. We need to make sure there's action, and we have to see what state COVID's at that point. If it's safe to do demonstrations, if it's not safe to do demonstrations, you do car cavalcades. But you do something to get so people can think I can take part in it. We're happy to share any leaflets we produce in our area. We're happy to work with people for a national leaflet. I'm more than happy to get stuck in to make sure that when we don't allow this Day of Action on February the 26th to be a kind of fluff piece from the Labour Party and the leadership of the unions that means nothing. We've got to make sure it really wakes people up. The other thing I would like, point one is do what you can through your local trades council. Point 1, 2, through your trade union, through some kind of action, and get out on the streets over it, either on street leafleting or giving out leaflets door to door. We also need to see, can we, is Steve still here? if we can pick up the issue from Steve and from Dave about, we need specifically a meeting about what's happening in the NHS and the American comrades. We need to know, we need a public meeting that someone who knows nothing about the way the American system works hears it, and hears it from Americans. We know we will get a big audience for that kind of a meeting, and we can have it. We can have Bob helping sponsor it. We can have Save Liverpool Women's Hospital sponsor it. We can have Keep Our NHS sponsoring it. We can have loads of different organisations sponsoring it. But that would be a core meeting to really get the message out about what happens in the States and how dangerous that is, and why the American companies should not be allowed to have it. So they're my suggestions. You know, there's an NHS meeting of Keep Our NHS Public and a big Zoom on, I think, the 19th of this month. I've put the link in the chat. Get onto that if you can. Be aware that you have to push the core issues. Don't accept the general, oh, we're all going to fight for the NHS. It's got to be that they mention maternity, that they mention mental health, they mention the, as Bob said, the A&E situation, and they mention the bill and the ICSs. All of those things have got to be mentioned. And then make sure that we build for February the 26th as a day of action in the areas, so that people really hear about what's going on, and we try and rouse the movement. Unfortunately, most campaigners for the NHS tend to be older, but the political position of the youth of this country is way to the left. And if we can rouse them, then we can get the pressure. And a core point of the pressure has got to be, as Pam said earlier, on the Tory MPs in working class districts. They've got to know they will be blamed, that it will be on their doorstep that the complaints come about the lack of service. They've got to know, they've got to be scared of the movement in action on those issues. So that's my proposals.
Thank you, Felicity. A lot of really brilliant, concrete proposals. We'll give John's had his hand up now since Felicity started speaking, so we'll give John the opportunity to come in and say something.
Yeah, well, I think it's been an excellent discussion, and Bob, again, who I had the pleasure to meet at the Resist Festival, gave a brilliant introduction. I'm just going to take a different tack, because one worry I have now is that the whole question of the pandemic has been handed down to individuals. And we've now got this divide and rule, vaccinated against unvaccinated, and things like that. So, you know, gaslighted away from the 200,000 or so who are dead in what I call a COVID cull. We're liable to have 60,000 or so nurses, perhaps even more, who aren't vaccinated, sacked, not because this government and the neoliberals care about health, it's because it's another way of bringing in private healthcare into the NHS. And I've seen figures, I don't know how real they are, recently on, you know, on very credible sources about the take-up of the vaccine. And I understand vaccine hesitancy and skepticism are relatively untried. And from what I understand, they went for the cheapest option possible rather than going for, you know, a vaccine based on the virus itself. But we're seeing now that there's low take-up amongst ethnic minorities and amongst manual workers. I saw something that it was less than 50% amongst manual workers. And I can understand that, because if I was still working in pit and I had the reaction to the vaccines that I had on 2 out of the 3 occasions and would have had to take 2 or 3 days off work, that's 2 or 3 days I'm not earning to feed my family. And so I do understand that, and I do worry that it's all being passed down to individuals. And it looks like there's going to be a deal done to keep Johnson in power amongst his more rabid backbenchers, that they're not going to support any dethroning of him by actually dropping every restriction whatsoever. And I think in a way we've been misled from start to finish. Bob said right at the start that a vaccine without a backup amongst social care has never been the real answer. You know, it helps, but you know, what has been the government, what have the government said to you if you had COVID right from the start? Stay at home and suffer. If you get ill, ring 1111 and they might send you an ambulance that, if you're lucky, will arrive within a few hours. And, you know, Bob talked about the problems with that. I had my own daughter very ill with COVID, and she rang an ambulance, and this rang 111. It took her an hour to get through. And when she did, they said, right, we're going to send an ambulance urgently. She put the phone down and it rang immediately. It was East Midlands Ambulance Service ringing to say, we've got this urgent call with no ambulances ready. Have you got a car? And she said, yeah, but I can't drive. They said, we're cancelling your ambulance. And that's it. And so stay at home, suffer and die. If you originally, if your loved ones had to isolate with you, can't get any food, no backup at all. And I'll go back to my original point. We are now being split asunder between the vaccinated and unvaccinated. And I'm telling you, if they bring in extra boosters after the reaction I've had to the last booster, I ain't taking it.
Well, okay, John, thank you for that. As always, you know, interesting, different way of looking at things and creating debate. I'm aware that the time for the meeting is beginning to run down. I'm certainly going to take away some of the points that Felicity made in terms of concrete steps that, you know, supporting this 25th of February National Day of Action. And we certainly in Morpeth, where my team of activists work, we've done stuff on the NHS before. We've always had a good response on the street, and we can do some more on that. Now, Bob, would you like, I'm now treating this as the end of the meeting. Would you like to say anything, Bob, in summing up this, what I believe has been a really good meeting, both from a point of view of understanding and practical ideas? Do you want to say anything, Bob?
Yeah, thank you. I just want to reiterate what I think are the most important points people continually fail to make. That is, the threat of the bill is handing over control of budgets to insurance companies. Their business model is to make profit through the denial of care. Everybody in this country, rich or poor, benefits from having universal, public, comprehensive health system. It's not about more money, because if you have a parasite-ridden patient, the solution isn't to give them more food. We need to remove the parasite of the market, the parasite of PFI debt, and certainly the infestation that is happening and will get worse of the private insurers. Any national campaign that doesn't mention America or insurance companies is a bogus campaign. So those messages need to get through loud and clear. In terms of the actions you can take, one very effective action is to pick up the phone and ring national radio stations, which constantly have debates on healthcare. They're often right-wing funded and have right-wing talking points. We need to counter those arguments and stop this divide and rule, blaming the unvaccinated, as John very eloquently put, or blaming migrants, or blaming the elderly, or blaming the sick for being sick. We have the arguments, we have the truth on our side, And we need to use whatever platform we can to make those points, because there is a huge propaganda campaign to make the counter arguments and to sucker us into accepting that the NHS as it was is unsustainable, and the only way is to look after number one, which would be a total tragedy and an inversion of the truth. So engage wherever possible. Thank you.